Good afternoon. I'm Doug Kane. I'm the Executive Director of the Providence Newberg Health Foundation. I want to welcome you to our very first Mondays with Mike and Joe. As the Director of the Foundation, our purpose is connecting people to Providence to advance research, patient care, and wellness. We believe passion is at the heart of giving. The Providence Newberg Health Foundation helps us move beyond ordinary patient care to profound excellence in all we do here at Providence. We strive to improve the lives of family and friends and contribute to the vitality of our community. Mondays with Mike and Joe will be a quarterly virtual series focusing on the role the Providence Newberg Medical Center plays in our community and how caregivers are working to improve health for all who live here. In today's gathering, if you have any questions for Mike and Joe, down at the bottom of this page, you will see the Q&A feature. Click on that button and you can ask a question. So what do you say we get started? Now I'd like to introduce Mike Donahue, a man who spent over 40 years as news anchor at Point 6 in Portland. Mike is also a current board member of the Providence Newberg Health Foundation. We are grateful for his service to Providence and our community. Please welcome Mike Donahue.
Thank you, Doug. Hello. I can't see you, but I suspect some of you may be eating your lunch right now. So while you do that, we are going to get to know Joe. That would be Joe Yoder. He is the new leader at the Providence Newberg Medical Center. Joe started his job in August of last year. That's right, in 2020. What a year to start a job in the medical field. Joe, where did you start? What did you do first?
Hey, Mike, good to see you, and thanks for the introduction. Well, where did I start? First, I had to figure out where my office was, how to get through the front doors with my temperature being taken, and all of the different restrictions that you could imagine weren't how I anticipated starting a new job. But once I got here, the team was welcoming and got me set in right away. We got to work.
I'm still a news junkie, and so I have read and seen and heard recently how your staff under your leadership are reaching outside the walls of this hospital to put shots in the arms to vaccinate this community. Outstanding.
Yeah, it's really impressive. We started off very early on when the vaccines became available. We had a partnership with Donahue County and TVFNR, and we did basically everything we could to host clinics on site here at our Newberg Medical Center campus. And we were able to see about 200-ish first responders and really frontline workers a day through those clinics. But really, that's been put into fifth gear in the last week. And big thanks to our partners up at Adex. They have opened their doors in their parking lot, at least, to allow us to set up a drive-through clinic. They have been helping us staff and support that structure. And when that's full speed and running, they're going to be able to see a couple thousand people through there a day, which is just huge news for us and our entire community, sort of inching closer to that herd immunity we all want.
Yeah, that's been very frustrating for people in this area trying to get a shot in the arm so they could be vaccinated. Joe got his undergraduate degree at Oregon State University, his master's at the University of Alabama. Joe, I heard that you were a quarterback in high school. Did you try out for the Beaver football team?
Well, I got to play several positions in high school, quarterback one of them. And I think as anybody who's played high school sports, you always have aspirations of being able to do something greater. I gave it a little bit of a run or try at Oregon State, emphasis on the word try. It doesn't take long, though, once you see what a real D1 athlete looks like to realize that your skills don't match theirs. And so I was able to pivot fairly quickly and find an area of study that I had a passion for and really kind of set me forth on a different route.
Joe is married to a nurse and they have two young children. But I understand there is one weekend during the football season when you have to be quiet around the house because of that connection you have to the Crimson Tide.
Yeah, so going to grad school down in Alabama, you quickly have to choose a side. You're either an Auburn fan or you're an Alabama fan. And clearly being in the University of Alabama system, I rooted for the Crimson Tide. But yes, Mike, as you've alluded to, my wife went to Clemson. So the last few years in the college football playoff have been a moment of silence for me. I have to keep my mouth shut and make sure I'm not offending my better half.
Well, the rest of the time you can be a Beaver believer, right?
That's right. Yeah. Beavers all the way every other week of the year for sure.
You have 14 or 15 years of experience now in hospital management. When you went to Oregon State, was it your ambition to get into this field?
Not originally. I started off on a path thinking I could go down the pre-med route and be a physician of some sort or in the care delivery realm. It only took a couple weeks of organic chemistry for me to realize that was not going to work out. And so I quickly pivoted. They, kudos to Oregon State. They had a burgeoning health management program, but they had this one little track that was really focused on health policy. And that really sunk its hooks into me and grabbed my interest. And so I switched gears and started a degree path towards a health policy and management program. And then that led to me starting some work with the Oregon Hospital Association after that.
Well, we're certainly glad you're here. That drive-through vaccination center isn't the only outreach by your staff to this community. I'm aware of a program known as BOB, which is Better Outcomes Through Bridges, where your staff under your leadership, again, are reaching out to people in our community who suffer from behavioral problems.
Yeah, that BOB program is something else. You wouldn't think of it as traditionally one of our roles to sort of go outside of our hospital walls and try to improve the health of the community in that way, but it's exactly aligned with our mission and our vision and what we want to be doing. And the space that the BOB program serves and the patients that they get to interact with are some of our most vulnerable and access challenged patients out there. And so it's a point of pride for all of us to know that they're meeting these folks and fulfilling some of just their basic needs of social determinants of health that we know, if they're not met, are going to cause, they have the chance to cause a ripple effect for the health outcomes of those people in the future. And so we're trying to work upstream and address some of those very early on.
And what's exciting to me is that you're doing this by connecting with community groups, with nonprofits, with faith groups, even with schools to make this happen.
Yeah, it's been impressive to me being in Yamhill County and seeing the partnerships that exist out here. And to your point, Mike, that BOB program is not successful without the community partner groups there to support it, from YCAP to the Community Wellness Collective and all the other groups in this community that help provide those wraparound services. It's amazing to me. And I don't want to say other counties aren't as successful as this one, but let me just say Yamhill County is leading the way when it comes to providing those services. It's impressive to talk to the group like the BOB program and say, well, that's a great ambition. You want to serve these patients, but how do you do it? How do you fund something like that? How do you make it work? And you just listen to them go down and say, oh, well, we have this connection over here who can provide this and this one who could do this. And they're sort of quarterbacking that and bringing it all together so they can create one access point for these vulnerable populations.
You know, of course, that you are leading a staff of 500 heroes. They have been outstanding. What they've done, they've saved lives during this pandemic. But at times, the job that they're trying to do it suffocates them. What are you doing to help them cope as the CEO of?
Well, I think it first starts just by listening to them and trying to be present and understand what the issues are. I don't think it's a secret to us that the heroes who walk through our halls every day and take care of patients in the midst of this pandemic, but then every other day of the year that they do that work is truly impressive, but it can wear on you after a while. The shortage of workforce in healthcare is real. And so our team here is working their normal hours and above and beyond that. We're constantly recruiting and trying to get the best possible staff we can in here. But that's a challenge nationwide right now. And so it becomes a question of resilience. And it's actually something that I'm most impressed about when I come to work every day, to see the same caregivers here caring for our community day after day, and they continue to come back with a smile on their face. It's inspiring to me, but it really calls the question of what am I doing to help support them? And to your point, Mike, it's I'm listening trying to capture all of their feedback and then provide some interventions. One of the exciting things that we're going to be doing later this year is putting together we don't really have a name for it yet, but like a relaxation type room. So a place of respite that our caregivers can go on their break to just have some peace and quiet and get away from a noisy break room or if it's raining outside, they can have a comfortable place to go inside the walls of the hospital. So that can't come soon enough, but we're excited to get that up and going. And then aside from a bigger project like that, it's just trying to fix some of the little barriers that are getting in their way to ease their way while they're here.
Good ideas. I was in your emergency room a couple of months ago, and I'll have to confess that at first I was a little concerned about getting COVID while I was there. But your staff and the precautions that they took made me feel very relaxed. And I actually, this is not an exaggeration, I actually felt safer there than I sometimes do in the grocery store.
Yeah, I've heard that before. If you walk into the hospital, our team here at Providence has done a remarkable job of both adhering to all the PPE guidelines. And then our supply chain team has done a great job ensuring that PPE is there and ready for the staff when they need it. And yeah, you come in here, we're going to be gowned up, we're going to have their mask on. Now we've started a program where we're testing all inpatients, even asymptomatic ones to make sure that we're not inadvertently contributing to the spread. And it's just been a nice partnership that we've had. And our team, while they're doing that to protect the patients, first and foremost, they're doing it to protect themselves as well. They don't want to contract anything, even though they are vaccinated now. But yes, I've been very impressed with our team's ability to stick to these strict guidelines that have, over the course of the year, probably changed 100 times for us. And we keep pushing out new practice alerts to them, but they're all up to date on them and doing things the right way. And it's something we should all be proud of.
As you've instituted those protections and as the word of mouth has spread that it is safer to go to the hospital, are you seeing an increase in the number of treatments that, let's say, were postponed during the pandemic? Are people coming back?
For a brief period of time, I would say last fall, as we started to see the incidence of COVID start to wane a little bit in the latter part of the summer, we started to see some of that volume pick back up. But then we know COVID started bucking its head again in November, and our cases started to ramp up. And so people were peeling back a little bit and not coming back in the way they had earlier in the fall. So I would say overall, if you net it all out, we're still down from previous years from volume through our emergency department or even surgical procedures, which on one hand is really good. I'd love to think that there's people out there who don't need our services. That's fantastic. We want a healthy community. I also fear, though, that I hope people aren't putting off care that is otherwise going to make them better off in the long run for a short-term fear. So I think it's yet to be determined what that means for us overall for long-term population health. But I just hope individuals are making the right choice for them and getting the care they need.
I'm sure you've discovered that the people of Newberg are very possessive and proud of their hospital, and they don't want to have to go to Portland to get medical care. They want to get it here. What are you doing as a CEO to make that possible?
Right now I'm still in an assessment period. So I should say too, Mike, I agree with this community of Newberg. This is a fantastic hospital, and there's very few services I believe that we should have to travel for. But keep in mind, we are a community hospital. So we're going to do things that can be done safely and consistently at a community level. There's tertiary and quaternary level of services that until this area grows to a certain size and scale, we're going to continue to have to send folks up north for some of those really high-end services. But anything that can be done at a community level, we want done here. And so what I've been doing these first few months out here in this service area is looking at what we provide today and trying to understand where the gaps exist, and then put a plan together to help sort of fill those gaps. Because I firmly believe that if it's something that can be done here in Newberg, it should be done here in Newberg, and we need to make sure that happens. So right now we're still in an assessment period, but hopeful that we get some plans put together here in the near term.
Another issue that you face as chief executive is the high cost of medical care. What do you do to make it more affordable to the patients of this community?
Yeah, thanks for bringing that up, Mike. That is that's actually the passion point that got me really interested in being in a healthcare leadership position. I firmly believe that the cost of care in this country is too high. And there's a lot of reasons for that, probably more than we have time to cover today. But boil it down to we just have a little bit of a misalignment of incentives in our industry. So what can we do to combat that here? You know, we're really fortunate being a part of Providence here in Newberg that we have a very aligned continuum of care. And we also have a very successful community care organization in the Yamhill CCO. I think there's opportunities for us, Providence, YCCO, and other partners in the community to come together to sort of align those incentives around one goal, and that's bringing down the cost of care and making it more affordable. It's been a little while since I've heard some of the statistics, but you know, there was a point in time when medical debt was one of the leading causes of bankruptcy in the United States, and that is just not okay. We should not be a contributor to people who are at one of their most vulnerable states to potentially have financial ruin because of a hospital bill. There, like I said, are many reasons that are underlying of that, but that is going to be one of our chief operating tactics, is to try to streamline care, lower the per unit cost of care, so that we can hopefully deliver that back to our community and employers in the form of lower premiums or just lower overall hospital bills.
You can do that, the community will give you an A+, I'm sure. When you first came, you said you thought Newberg and Providence Newberg Medical Center were perfect fits for you. What did you mean by that?
Well, I think it was twofold. One, the community is just, it's a great fit for me and my family's lifestyle. You know, being in a smaller town like this where you can get to know folks is huge for us. You know, I grew up on Air Force bases. Those are pretty small, tight-knit communities, and then had the opportunity to go to high school down here at Canby, just down the road. So a smaller town feel is what I'm used to. And so you marry that with the hospital itself. The reasons I mentioned before about my passion for being in healthcare and lowering the cost of care, I think we have a unique opportunity here in Providence, Newberg, to lead the way and be an example for the rest of our region and our country, really, on how to do that. If you look at the way we have built the structures here in Yamhill County and more specifically Newberg, you know, we've got all we need here to go in a fully aligned incentive way. And try to combat the high cost of care. And so having that capability and that potential there, plus the community that exists here, you put those together, and where else would I want to be?
Of course, Newberg and Yamhill County won't remain small as people flee Portland and learn about the attractive lifestyle here in the wine country, so to speak. Our population is going to grow. Do you have plans to deal with that growth?
Yeah, you know, I've been asked this question before about how we're going to grow with the community, and my answer is that we're going to grow with it. You know, we're going to do it the right way, and we're going to be mindful about how we do that. But it takes some pretty sophisticated analysis to figure out exactly what that's going to look like. We know there's going to be organic growth in this space for all the reasons you just mentioned, Mike. I mean, just look across the street from the hospital. We have a massive development going in. If you look at the Newberg City Commission site, you can see all kinds of other developments proposed and some approved for expansion of housing growth in this area. So there's going to be services that are needed here that we just know are going to come when more families move out here. There's also some spaces, like I mentioned before, that there might be programmatic or service line growth of a service that's not being met in our community today, where folks are having to leave our community for, that we might want to bring back in and grow that here locally. So our growth strategies will be intentional, and they will be matched to what our community's need is. But over time, it's really going to take like I said, the sophisticated look to understand is that really going to manifest itself in a need for more inpatient beds? in total, we know that healthcare is moving from inpatient to outpatient very quickly, and for all good reason. So we need to understand, as we grow, both organically and programmatically, is that going to drive inpatient volume or more outpatient volume? And then really sort of match our plans from a facilities growth standpoint to meet where we believe that growth is actually going to end up.
That new medical plaza across the street has enabled you to grow and accommodate some needs in the community. I know the physical therapy area over there gets a lot of patients, and that's consistent with your outpatient treatment philosophy.
Yeah, it's a beautiful space over there. That plaza is it's something else. And for anybody that needs any kind of therapy, that's an incredible space to be receiving treatment. There's also the new medical oncology space in that plaza as well. That was a new service brought to the community. They have more capacity. We anticipate that being an area of growth, both for locally here, but we also think there's some folks to the north of us that might decide to receive care down here versus going further into Portland for their care. But yes, that's a perfect example of how we believe outpatient space is going to be needed in the future. And we're trying to build the infrastructure here to be able to support new programs and services coming onto this campus.
I know I toured that plaza when it was under construction, and some of the views from that building out at the hills are just gorgeous. It was very well located and very well equipped. I had a question about your family. You, like many families, have been isolated somewhat during the pandemic. What have you and your wife done to keep the kids and yourselves from going crazy during this time of isolation?
Oh man, well, my wife and I call it park hopping. So we have a small little backyard, and so not a ton of room. We have two little girls, 4 and 2 years old. And you can just imagine they like to get their energy out. So we spend our weekends going from park to park to park to park, just trying to give them some space to run around and play. But it's tough sometimes when it's raining outside, and there's very few covered park spaces, and the kids get cold pretty quickly. So we play a lot of games inside, and got a little basketball hoop inside. I'm trying to get my older daughter acclimated to, and these little plastic golf clubs too. I let her knock things around with. I have dreams of one day her coming out on the golf course with me.
That's a great idea, getting out, going to parks, especially with little ones. Yeah, you said your wife went to Clemson. You went to Alabama. That doesn't look like you could get together. How did you meet her? How did that happen that the two of you got married?
It's kind of a funny story. We joke that we met online, even though I guess we really didn't. But so at the time, I had a roommate, and then she had a roommate. They had both met on, I think it was Match.com or something like that, one of those websites. And they had been on a date, and then it didn't work out. It wasn't going so well for them, and they decided to go on a second date. However, I came home from work one day, and I think I was sitting on the couch, just finished dinner or something, and my roommate calls me on his way home and says, "Hey, I need you to come to this restaurant and meet up with me. This girl I went on a date with, we're getting together again, and she's bringing her friend." So I reluctantly said, "All right, I'll go take one for the team. I'll come out there and keep you company." And so I threw on some jeans and went down there, and sure enough, my future wife was at the table, and we met. And it was that's all she wrote from there. We just started dating from that point on, and we had kind of a funny time when we actually got married. We made sure that both those two roommates walked down the aisle together as part of our wedding party. It was a good little fun time for them.
That's a great story. Being in a job like you have has to be really demanding, 24/7. How do you breathe? How do you get a time to yourself, or you have a hobby, a sport, or something that you pursue to give you that time to unwind?
Mike, I'm a golf junkie. I love playing golf, and kudos to my wife. She lets me play more golf than I deserve. But I love being outside, and really, in Oregon, you learn to play golf in any weather. So whether it's December and rainy and cold, doesn't matter. I'm going to be out there. I've got some rain gear. I love to chase that little ball around the course.
Sure that we have some questions from our viewers. webinar, but I want to ask you just briefly, do you have any short-term goals that you hope to accomplish while you're here?
In the short term, I think it's about bringing the services that can be done at a community level to the community and bringing those here. I know the challenge it takes driving from Newberg to Portland or Beaverton for a service that you quite honestly could receive in the community. So the short-term goal is to bring as much of that possibly to this community as we can. Longer term, it's about structuring those partnerships with our external providers and community members, and quite honestly, the payers and employers in our community, to figure out how we can align our incentives to save money on healthcare. So we're not spending what we are today. That's the long-term vision. That's going to take years to accomplish. The shorter term stuff might be more like a light switch. We can get in motion pretty quickly. But the longer term vision is what really fuels me and keeps me coming to work every day, to try to figure out how can we make this whole service more affordable for everybody involved.
Okay, I'm going to toss it back to Doug Kane right now. I think he is aware, I hope he's aware of some questions that maybe we're getting from the people watching this webinar. Doug, can you join us?
Hi, everyone. This is Nicole Wolfer, and I work with Doug Kane at Providence Newberg Health Foundation. And we do have a couple of audience questions for you guys. So the first one is, I believe this is based off Joe talking about the expense of healthcare. And the question is, what is Providence Newberg doing to keep expenses down, knowing that the cost of healthcare is so high?
Yeah, I think first and foremost, what we're trying to do is be good stewards of our resources. So for one, that's not wasting anything. We have a program where we reprocess things. We try to be as efficient as we can in our use of supplies and any sort of anything that drives expenses. We're very judicious when it comes to our use of hours and trying to match our staffing levels to volume so that we're not overspending on our different expense levels. Longer term, though, it's about us coming together as a team and understanding what are the drivers of expense that are not necessary. So, for example, I talk about bringing services here to the community. Well, that's great for our community to have a service available to them here. It's also good for expenses. If there's a person who comes into our emergency department that needs a service that we don't provide, and we end up having to transfer that patient somewhere else, well, that all costs money. And at the end of the day, that costs money to the system, but it also costs money to the patient to pay for that transport. So if we can provide that service locally and avoid that transfer of care, it's not only better for us, but it's also better for the total cost of care for everybody.
Great, thanks, Joe. Another question is, what is Providence Newberg's plan as the population grows?
Well, I think similar to I answered the question that Mike posed, our plan is to grow with the community. How that's going to happen, whether it's more outpatient growth or inpatient growth, I think is yet to be seen. We really need to sort of tease out what are the specific services that this community needs that are not being met today, and understand if those are drivers of inpatient volume or if those are drivers of outpatient volume. And then that's going to dictate exactly where we invest our dollars to grow for the future. We are also undergoing it's called a bed forecast, a bed needs analysis. So we've asked our system resources to pull out their books, and they've got complicated formulas and algorithms they go through to project, based on population trends, how many beds you're going to need in 5, 10, and 20 years down the road. And so we've asked them to redo that. I think the last time it was done for our service area was in 2015, 2016. And so we've asked them to refresh that to help inform that growth strategy, given all the movement that's coming on into our service area. So that will tell us more, in addition to our service line assessment, exactly where the investment is going to be needed.
What are some needs that you've identified so far? I mean, you mentioned the beds, the need for beds. What are more immediate needs perhaps that you're seeing?
I think the biggest immediate need we have right now is in pulmonology, honestly. We had a longtime pulmonologist here in the community who retired in October. And the group she was with is attempting to recruit to get a backfill for her, but we haven't seen that be successful yet. And so we're looking at ways that we might be able to assist in that recruitment to try to bring a pulmonologist out here, because I'm pretty certain that if you need pulmonology needs in Newberg right now, you're leaving the community and going elsewhere. There's a few different options for where you can go, but that's a community level service that we should be providing here, and something we are going to be working very closely to try to bring back here.
I have one last question from our audience today. Someone asked, how do you get signed up to get a vaccine at the Adex site, and can anyone sign up?
That is a good question. I know there is a process that's being triaged through the county. They're basically allowing all the signups and controlling that pathway. But I would have to lean on our folks who are setting up the clinic to know exactly how those signups are going. I don't think I could answer that for you today. Is that something, Nicole, that we might be able to post afterwards?
Yes, we will definitely be able to post that information on our Facebook page afterwards, after this is over with.
Okay, great.
So I just wanted to say thank you, Mike, so much for hosting today. And thank you, Joe, for being our very first guest on Mondays with Mike and Joe. And with that, I'd like to welcome back Doug Kane, our Executive Director of Providence Newberg Health Foundation.
Yeah, thank you, Mike and Joe, for being with us. And thank you all for joining us today. As a reminder, our next Mondays with Mike and Joe is scheduled for Monday, July 19th at 12 noon. We will be joined by Dr. Tom Johnson, medical doctor and medical director of our emergency department here at Providence Newberg Medical Center. Dr. Johnson will walk Mike and Joe through a typical emergency department visit, talk about COVID precautions and other services our emergency department provides. We hope you can join us to hear from Dr. Tom Johnson. If you would like more information regarding the Providence Newberg Health Foundation and ways you can provide assistance for our patients, visit our website at providencefoundations.org/Newberg. That's providencefoundations.org. You can also call or email me. On the screen is my contact information. Also, if you have any other questions for Mike and Joe, let me know as well. Thank you all for joining us, and we look forward to you joining us again on Monday, July 19th.